Today we are here with Dr. David Tate, who is one of the founders of the GIEQs Foundation. David, can you tell me a little bit more about the GIEQs Foundation and what is your goal with the GIEQs Foundation?
So GIEQs is a fantastic resource for any young endoscopist, any endoscopist who wants to go a bit further, upskill themselves a little bit in everyday endoscopy. So is that colonoscopy, is that gastroscopy, is that polypectomy, is that ERCP, is that whatever that it is, it's a platform to get across what I think works virtually in terms of education in the endoscopy space and in the basic endoscopy space. We set it up about 5 years ago now, and it has gone from strength to strength in terms of when people really discover this resource, they love it, they can't get enough of it, and they say that it's completely revolutionized their practice. There's a whole load of endoscopy which really does not need to be taught in an endoscopy room. All aspects of how the endoscope works, how you think about how you might introduce it, the steps that you take, the way that you perform insufflation in certain parts, the maneuvers you perform in which order, how you get to the second part of the duodenum, how you do retroflexion in the stomach. And then, okay, I found something that's maybe not normal. How do I characterize it? Is it okay? Can I leave it there? Should I biopsy it? Is this something which is actually maybe more concerning, maybe cancerous? How do I inspect that? What sort of photos should I take? I'm just thinking about a basic gastroscopy. And then what do I do with it? And where should the patient go? Because of course, we're doing this for patients. There's nobody else at the tip of the spear. What we strive for is they see a doctor who does a great procedure, who makes the right diagnosis and points them in the right direction. And that's what we're trying to provide in the virtual space.
In the past, as we all know, it was always hands-on sessions, it were live endoscopies. Where is the position of digital education in the whole platform?
You cannot spend a lot of time receiving face-to-face training in endoscopy, not easily, right? So the question is, how can you augment, preload, improve that face-to-face education so that you get the maximum value out of the face-to-face training that you do? And I think that is virtual education. And you really can upskill your ability to do these basic endoscopic procedures, advanced endoscopic procedures, by training yourself in the virtual space. They, of course, complementary, but in my view, it's 80-20, and it's 80-20 in favor of virtual.
Okay, and how do you see the position of your GIEQs Foundation, and how do you want to see that in the future?
I see GIEQs as a foundation, a non-profit, which seeks to promote excellence in basic endoscopic procedures. But of course, if you are great at basic endoscopic procedures, you have a solid foundation for advanced endoscopy. That's one very important thing. You do great outcomes for your patients. And hopefully GIEQs can also move into the space of standardizing endoscopy education, because I think that is critical. We do want to provide a framework where everybody can deliver their education in a similar way.
I really would like to thank you and hope together we can make it a success and train all the physicians all over the globe better.